Okay, good morning everyone. Today we are going to start with a new chapter, that is drug information service. As you've already discussed about various topics in this subject, now we are moving towards the next chapter, drug information service. Okay, so we are trying to talk about the informations about the drugs. So we have various services which are providing the information regarding the drugs. But why the drug information is needed? Since you know about the drugs, you need the mechanism of action in ADR. But a lot of things or aspects are there when you're trying to treat any of the patients, right? So you need some updated information about that particular drug, okay, to achieve the therapeutic outcome. So that is all about, we are going to talk about the drug information services, how it is being done, why it is needed, how it is been working over in India, and how that helps pharmacists to take care of the patient's health. Okay, so what is drug information? It is defined as the knowledge of facts through the reading, study, or practical experience on a chemical substance that is used in diagnosis, prevention, and treatment of the disease. So it covers all the types of information, including the objective, subjective information, as well as the information gathered by scientific observation or the practical experience. So if any of the pharmacist is seeing any observational things in that particular drug while treating any of the patients, he gathers some information, he gathers some observation. Okay, and in other aspects, if clinical research has been done, so if they can gather the same thing, and they can make sure they are collecting that information, and they can just make sure they can make a data of that particular drug, and they just can gather the information all perspective, whether it is based on the diagnostic perspective or prevention or the treatment of diseases. Okay, so what is drug information service? The drug information the drug information service, it describes the activity undertaken by a pharmacist in providing information to optimize the usage of the drug. So the services which covers specially a trained individual, it can be physician, it can be pharmacist, okay, who provides an accurate and unbiased information in response to the patient's oriented drug problem received from the healthcare professional. So what they are trying to say is, whatever information you gather while practicing, the practicing can be of any of the medical professional. By treating that particular patient, you observe anything, you find anything, you need to inform, and you need to gather the information regarding that particular drug. So that is all about drug information services. If I am talking about information, that means we are talking about all the aspect scenario in terms which you have observed, which you feel so while treating, or while the drug was used while treating that particular patient. So that is drug information service. See, this is totally different from Indian pharmacopoeia and all other thing. ओके, इंडियन फार्माकोपिया हो, हॉस्पिटल फॉर्मुलरी हो, या कोई अदर चीज़ें हो जिसमें इंफॉर्मेशन आ गया वो आ गया, ठीक है, वो अपडेट करते रहते हैं, लेकिन उसके बारे में अगर कुछ भी प्लस और माइनस आई हैं तो उसको अपडेटेड करते रहना फिजिशियन और मेडिकल प्रैक्टिशनरों का काम है, और उसको इन्फॉर्मेशन गैदर करके रखना, ताकि अगर कोई भी क्वेरी आ रही है, कुछ भी इश्यूज आ रही है, तो ड्रग इन्फॉर्मेशन सर्विस के ज़रिए हम उसके रिलेटेड अपडेटेड चीज़ें जान सकते हैं, जिससे हम पेशेंट्स की थेरापेटिक गोल को अचीव कर सकते हैं. तो दिस इज टोटली डिफरेंट. इफ़ यू वांट टू बाय अ कार, यू नीड इन्फॉर्मेशन, राइट? ऐसे भी आपको नेट पे अपडेटेड इन्फॉर्मेशन मिलेगी, लेकिन अगर आप कोई सर्विस शोरूम में जा रहे हैं तो यू विल गेट अ बेटर इन्फॉर्मेशन बिकॉज दे हैव अपडेटेड वन. सो इन एवरी टर्म्स यू नीड टू हैव सम अपडेटेड वन. तो जो भी अपडेटेड इन्फॉर्मेशन होगा, दैट इज प्रोवाइडेड बाय द ड्रग information service, or we say that drug information center is the another name, which are the organization which provides this services. Okay, so why do we need a drug information? The neo drugs are generally more potent and selective, and formulation becomes increasingly complex, right? So you have various new drugs which are more potent and selective. So the formulation which are based on this particular drug can be more easier, or more, it can allow you to achieve the therapeutic goal. But since you have a lot of formulation, it creates a complexity, and it finds to be difficult to practitioner or a pharmacist to choose which formulation can be given to the patient, right? So you need drug information for that, to ease your complexity. Then the literature on drug has also expanded and coverages a wide range of informations. If we have a literature which has a vast expanded theory about all the drugs, so you need information about that for achieving a better therapeutic outcome. Then to introduce a new drug into practice, the professional needs to evaluate the given information. If you want to introduce your new drug to any practice to treat the patient, you need some core information which can gather up, which can gain a trust in yourself, and you can just give the drug for that patient's therapeutic outcome. So you need this information, right? then a simple quick reference to a pharmacopoeia formula is no longer sufficient. If you're trying to see the pharmacopoeia, it is very big, and if you're trying to see the formula, you won't get that much sufficient information and updated one. वो पहले का वर्जन होगा, आपको अपडेटेड वर्जन चाहिए, लेकिन वो मिल नहीं रहा है. तो आपको अपडेटेड वर्जन, ये सारी जो चीज़ें वो ड्रग इन्फॉर्मेशन सेंटर से या ड्रग इन्फॉर्मेशन सर्विस जो प्रोवाइड करते हैं वो सेंटरों में से आपको इजीली मिलेगा, जिससे आपको अपडेटेड इन्फॉर्मेशन से यू कैन हैव अ बेटर एप्लीकेबिलिटी ऑफ योर नॉलेज टुवर्ड्स द therapeutic outcome. So these are all the aspects where you need a drug information just to understand or to achieve a good therapeutic outcome in the patient. Next, what are the aim and objective of the drug information service? What are the centers which are providing the drug information services? What is their aim and objective? Their aim and objective is the provision of information to health professional on specific problem related to the use of any drug in the particular patients. So that is their objectives. The provision of information to the official and government is to optimize the decision making process. If they see and so they need to optimize the, so if the government want to take any decision, they will ask these drug information centers whether they want to optimize any of the process or the things which creates a problem to the healthcare sector. Okay, then preparing the development of any guidelines and formularies, then to improve the patient's compliance and provide a guide to responsible self medication. If we feel so that particular drug has to be taken, should not be taken, whatever appropriate guideline has to be provided for the self medication, that all is been laid down by the drug information services agencies, help and authority. To develop and participate in education program, that is all the function and objective. Then to participate in undergraduate and graduate teaching program. Then to develop an educational activities regarding the appropriate use of drug for patients in the community. Again, they are trying to deliver social welfare programs. Then to prepare and distribute material on drugs to the help of in form of drug information bulletin or other. This is a very important one. They try to publish a drug information bulletin. जैसे जर्नल्स होते हैं, पीरियोडिकल जर्नल्स होते हैं. अगर आप फॉर एग्जांपल आप स्कूल में थे तो स्कूल में एक पीरियोडिक, एक वीकली एक जर्नल होते हैं, मंथली एक जर्नल वो लोग publish करते हैं, that which contains all the information about the schools, programs, annual day and everything. In a similar manner, the drug information bulletin is published by various associations. For example, Indian Pharmaceutical Association is having the drug information bulletin, which has been accepted by each and every of the other organization, and they try to gain the knowledge and whatever information is laid down in that particular bulletin. So that is all the work of the Drug Information Service Center. Then to develop and participate in various research programs which are going under for various new drug or marketed drug or post-marketing surveillance drug. So these are all the aims and objectives of the drug information services. Now talking about this was all about, but what is the source of information or resources available if you're talking about if you need to gain any drug information. क्वेश्चन ऐसा आता है कि आपको ड्रग इन्फॉर्मेशन चाहिए तो आपके पास कौन से ऑप्शंस अवेलेबल है, सोर्सेज अवेलेबल है जिसके ज़रिए आप इन्फॉर्मेशन को गैदर कर सकते हैं. सो प्राइमरी, सेकेंडरी, टर्शरी के बेसिस पर मैंने यहाँ पर एनलिस्टेड किया है. जस्ट ट्राई टू अंडरस्टैंड फर्स्ट वन वी आर टॉकिंग अबाउट, दैट इज प्राइमरी सोर्स. द इन्फॉर्मेशन हियर इज प्रेजेंटेड बाय द ऑथर विदाउट एनी इवैल्यूएशन ऑफ सेकेंड पार्टी, प्रोवाइडेड मस्ट करंट इन्फॉर्मेशन अबाउट ड्रग. एग्जाम्पल आर्टिकल पब्लिश इन जर्नल एंड थीसिस. अगर आपने कोई भी रिसर्च वर्क किया, फॉर एग्जांपल कोविड वैक्सीन की रिसर्च चल रही है, सो दे हैव पब्लिश समथिंग बट दे आर नॉट टॉकिंग टू एनी सेकंड पार्टी एंड दे आर ट्राइंग टू आस्क और दे आर नॉट सीइंग एनीथिंग बिकॉज दिस इज अ न्यू वन, राइट? So they are publishing their own article in the journals which have a pure information based on the author's criteria, and authors have performed some research and he found some observation and he is publishing that in his own journal, in own article. So that is considered to be as a primary source of information of any of the drug. Then we are talking about the secondary source. So this original source has been evaluated by second party other than publisher, and it is modified or re-informed. For example, review article like Lexinix, Medline. We have various review articles which are found in this all databases, right? So secondary source is said to be can be considered as a review article. Primary source can be considered to be as a research article. Okay, so secondary article contains all the review article. How the review article is made? They see all the research article published based on that particular disease or particular drug. They collect the information and they summarize them in a short form, and that is said to be as an review article, and they publish that review article in any of the journal. So that can be considered to be as a secondary source. Then you have a tertiary source. Information obtained from primary and secondary, for example, pharmacopoeia, BP, USP, IP, encyclopedia, dictionaries, guides, and some textbooks. We can say some books like H.L. Sharma or whatever books if you want. They have updated version. If you see any of the chapters in H.L. Sharma, you have further reading type of reference in they have given in every each and every chapter. सो व्हाट इज देयर ट्राइंग टू से इसकी आप और भी ज़्यादा इन्फॉर्मेशन गिन सकते हो, लेकिन ये जो इन्फॉर्मेशन है हमने इस बुक से या इस जर्नल से उठाई है. सो टेरिशरी सोर्सेज कंसिस्ट ऑफ ऑल दिस एस्पेक्ट्स who are dependent on totally on primary and secondary source. After having all these sources, then you have drug information center. We also receives information from the public and the hospitals of areas of any of drug. Then local drug lists, formularies, internet, phone calls from manufacturer to manufacturer, government and non-government organization. So they gather the information from this all population based aspect like public, hospital, formulary, government, manufacturer, and they gather the updated information जो ऊपर के तीनों के sources में available नहीं है. And these they collect this and they keep it with you. And if suppose you are practicing and you ask for any information, you will get the information from these aspects as well. So ये information बाहर नहीं आता है, तो ये information भी आपको कहाँ से मिलेगा? ड्रग इन्फॉर्मेशन सेंटर में, क्योंकि ये लोग जो होते हैं इन सारे चीज़ों से लोगों से कनेक्टेड होते हैं, पीपल से भी कनेक्टेड हैं, हॉस्पिटल फॉर्मुलरीज के जो बनाते हैं उनसे भी कनेक्टेड है, थेरापेटिक कमेटी के पीपल, लोकल ड्रग, फ़ोन कॉल्स, मैन्युफैक्चरर, पब्लिक, हॉस्पिटल, सारे लोगों से कनेक्टेड, जिससे आपको तुरंत ही इन्फॉर्मेशन मिलेगा. प्राइमरी, सेकेंड एंड टर्शरी तक आपको ढूंढना, समय लगाने में जितना टाइम जाएगा उससे अच्छा आप DI से आप इन्फॉर्मेशन तुरंत गैदर कर सकते हो और तुरंत अपने थेरापेटिक आउटकम को अचीव कर सकते हो जो भी पेशेंट में आप चाहते हो. सो दिस इज हाउ द सोर्स ऑफ इन्फॉर्मेशन इज अवेलेबल for any practical practitioner, but we go straight away to DIC who give us information and updated information which create a easiness and decreases our complexity regarding that drug. Okay, then drug information skill. So how generally the information is being gathered, that is all we have to understand. See, first step is we secure a demographic of the requester, whoever in requesting any information. We try to understand. Being a pharmacist, you need to understand this. अगर आपको किसी ने कोई रिक्वेस्ट भेज दिया, आपको DIC सेंटर में काम कर रहे हो, सबसे पहले आपको दिमाग में क्वेश्चन आएगा कि ड्रग इन्फॉर्मेशन सर्विस है कहाँ, सेंटर कहाँ. सो ड्रग इन्फॉर्मेशन सेंटर में आपको बता दूँ, गुजरात में के बाईपर कॉलेज है, काडी सर्वा विश्वविद्यालय यूनिवर्सिटी है गांधीनगर में, पारुल यूनिवर्सिटी है, दे ऑल्सो हैव ड्रग इन्फॉर्मेशन सेंटर. तो ऐसी बहुत सारे इन्फॉर्मेशन सेंटर हैं जहाँ पर इस तरीके से ये स्टेप्स फॉलो करके दे गैदर द इन्फॉर्मेशन और इन्फॉर्मेशन दिए जाते हैं जिस तरीके से रिक्वेस्ट आते हैं उस हिसाब से. सो लेट अस ट्राई टू अंडरस्टैंड. आप एक फार्मासिस्ट है, यू आर वर्किंग इन एनी ऑफ दिस सेंटर. सो स्टेप 1, you are securing the demographic of the requester, whoever also requesting the information. You are trying to find who is requesting. You find whether he is a medicinal and non-medicinal person, whether he is educated or uneducated. Then you try to find the name, location and phone and email ID of that particular requester. Then you obtain the background information like where the requester heard about that particular drug, he is taking any medication, why, and then he or she is caretaker want to take that medicine. So you try to find the background of that information of that particular requester. Then third step, you determine and categorize the ultimate question. Putting the pieces information together, you form ultimate question, and once it has to be determined, the next step is to categorize the question. एक बार आपने summarize कर लिया उसके problem क्या actually, तो आप क्वेश्चन को फ्रेम कर देंगे एंड यू ट्राई टू फाइंड कि कैटेगराइज ये किसकी प्रॉब्लम क्या है, क्या वो एरिया रिलेटेड है, क्या उसको इन्फॉर्मेशन चाहिए, या फिर उसे कुछ डिफिक्ट नज़र आया है या प्रॉब्लम नज़र आया है जो कि हमें नोट डाउन करना है. तो किस तरीके से वो क्वेश्चन है उसको आपने कैटेगराइज कर लिया, वो आप स्टेप्स थर्ड में आप करेंगे. देन you have step 4, you develop a strategy and conduct the research what you want to answer. You try to find the answer तो डैट पर्टिकुलर क्वेश्चन, जैसे कैटेगरी टाइप ऑफ क्वेश्चन होगा उस तरीके से आप अपनी स्ट्रैटेजी लगा करके आप फाइंड आउट करेंगे कि किस तरीके का इन्फॉर्मेशन वो रिक्वेस्टर मांग रहा है और मुझे कैसे देना है. देन यू परफॉर्म द इवैल्यूएशन, एनालाइज एंड यू ट्राई टू गैदर ऑल द answers to that particular to act as a good reply. Then you formulate the reply and provide the response to that particular person based on all the necessary proof or database which you have with you. Then further, after providing the information, you conduct the follow-up and document it. This question was asked and based on this answer was asked based on this all data which was available at that particular time. So these are all the steps which we can see over here. which are done or it can be considered to be as a steps for conducting or work for drug information services for any requester who is trying to find information for any updated drug. Okay, so these are all the steps which has to be which considered to be as an information skill in drug information center. Okay, next. So drug information center, as I told you, we have drug information center in Parul University, we have drug information center in K.Bipar College, Kadi Sarva University. These are all present in Gujarat, where we can have the information. You can call them. You can, if you want to find, they have a request form in their website. You just fill the request form. They will reply you by mail or by phone. Okay. So drug information center is general a service provider which provide drug information relating to therapies, pharmacoeconomic, education, research. It provides the information to the healthcare professional and patients and consumer. So many centers provide workshop forms of training to enhance the skill of the healthcare professionals. So जैसे कि हमने पहले ही पढ़ा था एम एन ऑब्जेक्टिव में कि कुछ प्रोग्राम्स भी होता है वो कंडक्ट करते हैं to enhance the skills of that healthcare professional. So it is generally a center which is located within or affiliated large organization or pharmaceutical association or hospital or a university which are acting as a drug information center and provides the information to the healthcare professional. So in Gujarat, as I told, we have Kadi Sarva Vishwavidyalaya, Gandhinagar, K.Bipar College, and we have Parul University which are acting as a drug information center. These are the most 2-3 and names. Many more can be there, but these are there in Gujarat. Okay. Then we have, these are all the staffings which are included in a drug information center. A pharmacist with a special knowledge about drug and action associated with the academic degree. Then we have pharmacist technicians, students who are also working, people trained in library science with the computer knowledge who can try to retrieve the database. Then the centers having a specific hour of operation who can provide information to the medical personals. Then the drug information has a latest publications and publish a letter or other information update which they need to be published, and that is considered to be as an information bulletin regarding the all the drug aspects. So उनके भी periodically publishing होते हैं, वर्जन्स होते हैं. तो ये सारे स्टाफ्स होते हैं जो मिल करके इस तरीके से वर्क करके ड्रग इंफॉर्मेशन सेंटर को चलाते हैं. दिस इज हाउ दे वर्क. Okay, so that is all about the staffing. Then as we are talking about pharmacy, so we will be more related to pharmacist. So he is a part of DIC who is ready to go for information for all the time. He tries to find and always ready to for giving information to all the person who seek the information. The drug information pharmacy is acting as an interface of vast amount of knowledge on site in person, meaning knowledge on the other side. He provides a proper information inventory of the informer status and accordingly with the informer status. अगर वो मेडिकल प्रोफेशन है, नॉन मेडिकल प्रोफेशन, वट एवर इट मे बी, ही सीक्स इन्फॉर्मेशन. अगर उसकी रिक्वेस्ट आई है तो उस तरीके से उसके इन्फॉर्मेशन को गैदर करके प्रोवाइड करना इज बेस्ड ऑन ऑल द नॉलेज ऑफ दैट पर्टिकुलर फार्मासिस्ट. सो फार्मासिस्ट हैज़ अ वेरी इंपॉर्टेंट रोल इन एनी DIC, that is drug information center. So that is all about we are talking over here. So what will pharmacist do? जो भी रिक्वेस्ट आएगा उसे कलेक्ट करेंगे, जो भी डेटाबेस लाइब्रेरियन हो गया उसके साथ बात करेंगे, डेटाबेस को कलेक्ट करेंगे, रिव्यू करेंगे, फिर रिक्वेस्टर को आंसर देंगे, फिर उससे फॉलोअप लेकर के उससे कुछ भी क्वेरीज लगती है वो फर्दर उसको सॉल्व करेंगे. इस तरीके से फार्मासिस्ट का रोल होगा पूरा. ओके, दैट इज हैव बीन सॉर्टेड आउट इन दिस 3 लाइन्स, वी कैन से दैट. ओके, देन drug information bulletin, as I told you, this constituted of all the aspects of medical professional, teaching or researcher, or all the medical professional who are working in any of the association, or if they are in if they are working in organization like hospital or whatever it may be, they release some information about the drug that is said to be as drug information bulletin after performing various meetings. They perform various meeting with respect all the medical professional regarding that particular drug. We can say pharmacy therapeutic committee also हम बोल सकते हैं, physician बोल सकते हैं, pharmacist बोल सकते हैं. ऐसे कोई भी ऑर्गेनाइजेशन है वो लोग कुछ भी डिस्कस कर रहे हैं, डिस्कस करने के बाद उस मीटिंग होने के बाद वो ड्रग बुलेटिन बनाते हैं और वो बुलेटिन बना करके वो उस बुलेटिन को रिलीज़ करते हैं. ठीक है. सो ड्रग इंफॉर्मेशन बुलेटिन रिलीज करते हैं फॉर देयर बेटरमेंट एंड फॉर द बेटरमेंट ऑफ द सोसाइटी. इट कैन बी स्ट्रिक्टली टुवर्ड्स द ऑर्गेनाइजेशन वन और इट कैन बी बेस्ड ऑन द एसोसिएशन वन. फॉर एग्जाम्पल, अगर मैं इंडियन फार्मास्यूटिकल एसोसिएशन का मेंबर होता हूँ, हमने ड्रग बुलेटिन बनाया, तो इंडियन फार्मास्यूटिकल एसोसिएशन से जो भी एफिलेटेड ऑर्गेनाइजेशन है उन सारे के पास वो ड्रग इंफॉर्मेशन बुलेटिन जाएगा और वो सारे चीज़ वो उसको फॉलो करेंगे या फिर नॉलेज गेन करेंगे. तो उसी तरीके से जो भी इंटरेक्शन करे, अभी फॉर एग्जांपल डाइटिशियन है, तो डाइटिशियन के रिलेटेड इन्फॉर्मेशन बुलेटिन बनाया गया, तो वो ही डाइटिशियन फॉलो कर सकता है, कोई भी फॉलो कर सकता है, बट दैट इज विल बी प्रोवाइडेड और पब्लिश टू दीज पीपल हु आर comes under the field of dietitian. Okay, so that is all about the drug information bulletin. So after reviewing a lot of research work, review article, they have a meeting with all the experts, then further they gain the knowledge, then further they create they gather this information and they just publish it in a form of drug information bulletin. It can be organizational based or it can be public based, whatever it may be. Okay, so that is all about the drug information bulletin. Okay, then we have poison information service. We have poison control centers as well, who also have these, they also have the teaching and training profession who perform, who give educational programs to all the community people, but they have, especially they have a toxicovigilance toxicologist, okay, who has a more deep knowledge regarding the toxicants which are provided in environment. It can be pesticide, insecticide. Okay, they have a more knowledge about the environmental toxicity, then they have more knowledge about the chemical. Okay, they have a knowledge regarding these all aspects. Okay, so इनके जो staffs होते हैं, they don't talk about therapeutic outcome, they talk about the safety outcome. Okay, जो भी इनको toxicity नज़र आती है, environmental हो, जो भी उनको information है, toxicant हो जो रिलीज हुई है वाटर में हो, या फिर एक्सीडेंटल कुछ चीज़ें हो, तो ये सारे टॉक्सिकोलॉजिस्ट इन्हें हम कहते हैं. वी डोंट से फार्माकोलॉजिस्ट. सी, टॉक्सिकोलॉजी एंड फार्माकोलॉजिस्ट आर लिंक्ड टू ईच अदर, but toxicologist will talk about only toxicity and he will be having more focus regarding safety, whereas pharmacology will be talking about the therapeutic outcome. He will ensure the safety, but he will be having a more approach towards the therapeutic outcome. So the pharmacist working over here will be generally have a more knowledge regarding the toxicity. He will be a I can say he will be a master's from toxicologist, or a physician who is having more regarding the toxicology. Then we have environmental persons who have a information regarding the environmental chemical which is creating toxicity and chemical incident disaster. Together these people are working in poison information services. Okay, so where do you have poison information service in Gujarat? We have National Institute of Occupational Health and Hazard Center in Ahmedabad, NIOS, that is said to be as NIOS, National Institute or Occupational Health Center, which is present in Ahmedabad. They have their poison information center who are working for under this roof. Okay, who are having these all staffs who are working together as a poison information service center. Okay, then drug information and retrieval storage. Since you know you need to retrieve the data, and you need to store it and you need to retrieve the data whenever it is required. So ऐसी बहुत सारी चीज़ें हैं कि आपको रिट्रीव भी करना पड़ेगा जब आपको ज़रूरत पड़े. तो हमारे पास बहुत सारे डेटाबेस है जिसके ज़रिए आप ये काम कर सकते हैं. ये सारे फॉरेनल डेटाबेस हैं, जैसे कि फर्स्ट डेटाबेस दैट इज़ डाउन, ड्रग अब्यूज़ वार्निंग नेटवर्क. ओके, देन वी हैव क्लाउड, कंप्यूटराइज लिस्टिंग ऑफ अबनॉर्मल अनयूजुअल ड्रग इफेक्ट. ठीक है, ये सारे खुद के ऑर्गेनाइजेशनल प्रोग्राम है जिसमें आपने कोई भी आइडेंटिफिकेशन कोड दे दिया है अथोराइज पर्सन को, जो भी पर्सन पेशेंट इज यूजिंग दैट पर्टिकुलर नार्कोटिक ड्रग. फिर वो जब रिफिल करने आएगा या फिर जब उसने अपने वो कोड बोलेगा, तो आपको सारे इन्फॉर्मेशन उसके ड्रग और एडीआर के रिलेटेड आपको सारे इन्फॉर्मेशन गैदर हो जाएंगे, वो ड्रग के रिलेटेड और वो पेशेंट के रिलेटेड, बोथ द कनेक्टेड ड्रग इंट्रैक्शन एंड ड्रग इंट्रैक्शन विच इज फाउंड इन दैट पर्टिकुलर पेशेंट. तो ये सारे इन्फॉर्मेशन आपको इसी में से गैदर हो जाएंगे. अगर आपको इन्फॉर्मेशन हर एक पेशेंट में वो नज़र आ गया, वो एडीआर नज़र आ रहा है, तो आपके लिए एक इन्फॉर्मेशन बन गया कि ये ड्रग यूज़ करने पे ये एडीआर नज़र आ रहा है, विच कैन बी हेल्पफुल फॉर अदर medical professional who are going to use that particular drug for the patient's therapy. So down and cloud is a program which is being used for retrieving as well as storing the information regarding that particular drug. एंड इसमें आपको बुक्स लेकर के खोल के बुलेटिन दे करके जो समय नहीं लगाना है, प्रोग्राम है, आप डाल दोगे, ड्रग भी डाल दोगे, तो आपको डेटाबेस में से सारे इन्फॉर्मेशन रिट्रीव हो जाएगा. एंड यू कैन जस्ट अंडरस्टैंड इन अ शॉर्ट टाइम कि मुझे क्या आपको करना है, क्या आपको क्या ढूंढ रहे थे और आपको अभी नेक्स्ट एक्शन क्या लेना है. Okay, so these are all the computer related program information which allow us to take the or gain the necessary information. Then on other line we have Medline, we have National Library of Medicine, we have Medlars, medical literature analysis of retrieval system, and last but not least in a ऑनलाइन ऑफलाइन मोड वी हैव मार्टिनडाइल्स एक्स्ट्रा फार्माकोपिया. सी फार्माकोपिया तो जनरली आपने देखा होगा, मोनोग्राफ होगा, सॉल्युबिलिटी होगी, सारे फार्माकोएनेटिक रिलेटेड सारे एस्पेक्ट्स उसमें होंगे, राइट. सो मैटेंडल्स एक्स्ट्रा फार्माकोपिया में आपको ड्रग की इंफॉर्मेशन की अपडेटेड जो भी चीज़ें हैं, सारी चीज़, चाहे वो फॉर्मुलेशन हो, चाहे वो अब्जॉर्बेंस वो हो, चाहे वो डायनामिक बेस्ड हो, जो भी इफेक्ट्स, जो भी चीज़ें आपको नज़र आ रही हैं इन दैट पेशेंट्स or that drug related, you can find all database in Martindale's extra pharmacopoeia. There's a book. Okay, then we have these other databases like is Medlar, Medline, we have Micromedex. These are all the computer based retrieval storage and database system where you can store the information and you can retrieve the information as well, and you can use it for your data for drug information aspects. Okay, सो दैट इज दिस आर ऑल, ये आप नेट पर सर्च करके देख सकते हैं, माइक्रोमेडेक्स, मेडलाइन और ये सारी चीज़ें, ये सब प्रोग्रामर आप मार्टिनडल्स भी देख सकते हैं, एक बुक है, ठीक है. तो ये सारे प्रोग्राम्स हैं जिसके ज़रिए आप अपने जो भी ड्रग्स के इंफॉर्मेशन है, डेटा स्टोर भी कर सकते हैं और उसको आप इजीली रिट्रीव भी कर सकते हैं, ठीक है. देन वी हैव इंटरनेशनल फार्मास्यूटिकल एब्स्ट्रैक्ट. ओके, सो दीज आर ऑल द इंफॉर्मेशंस through which you can store and retrieve the data of that particular drug. Then since computer is the various simplest one and the easiest one, it has a lot of advantages since it is time saving in conducting the literature review, as we know. And if you don't have computer system, a pharmacist requires several hours to research a particular question from a literature and conveying about 10 years of article. It can be done in 10 minutes by just doing a search in the computer, which is more pleasant, right? सो अगर आपको लिटरेचर सर्च करना है तो आप ढूंढोगे, आपको बहुत समय लगेगा, आप आंसर नहीं कर पाओगे. लेकिन आपके पास कंप्यूटर प्रोग्राम है जिसमें ऑलरेडी डेटा बेस है, तो उससे इजीली आप आंसर फाइंड करके रिक्वेस्टर को आप रिस्पॉन्ड कर सकते हो. ओके, सो वी हैव अदर डाटा बेस जैसे बिब्लियोग्राफिक, जनरल इन्फॉर्मेशन, टेक्स्ट बुक मटेरियल, बट ये सारे आपको इसमें से रिट्रीव करते में बहुत समय लगेगा. सो जनरली वी हैव दिस प्रोग्राम बेस्ड विच डाटा बेसेस अवेलेबल हैं जिसमें आप डेटा स्टोर भी कर सकते हो और किसी को भी रिट्रीव करना है, एक लॉगिन अकाउंट बना करके आप उसमें से अपना डेटा स्टोर भी कर सकते हो और रिट्रीव भी कर सकते हो. सो दिस इज ऑल अबाउट वी आर टॉकिंग ओवर हियर. सो दैट इज द एडवांटेजेस ऑफ कंप्यूटर इंफॉर्मेशन सिस्टम इन ड्रग इंफॉर्मेशन services. Okay, so hope you all understood. If you have any query, just DM me on WhatsApp. Okay, so this is all about the drug information service, or we can say drug information center. Okay, thank you.